So the question is hallucination a part of outcome of hypnosis? And the answer is no. The problem arises from the way Freud uses the word hallucination and the way we use the word hallucination today. So today we use the word hallucination to signify a psychosis where you see something which others can't see, or you hear something which others can't hear. So we refer to the visual hallucination or auditory hallucination or tactile hallucination. You feel something which is not there to feel. So we call something hallucinatory when something which is not there in reality is seen or heard or felt. In medical colleges, in the psychiatry department, often you will see a poster stuck on the walls, and the poster says, if you talk to God, it is prayer. But if God talks back to you, it is schizophrenia. So, hallucination refers to seeing what is not there, hearing what is not there, or feeling what is not there. This is how we use the word today. Freud is using the word hallucinatory to mean it is almost mimicking reality as though it was just happening with the same vividness. So when he uses the word hallucinatory, he means with the same intensity as though it was happening now. So when he says in hypnosis, we make the person recollect memories with hallucinatory vividness, he means that the person recollects the memory as though it was happening just now or had happened just yesterday. So what he means is very intense and very real vividness. So intense and real is what he wants to mean by the word hallucinatory. He does not use the word the way we use it today. Is it
okay? Clear? Yes, sir.
So when in Freud's language, when hypnosis brings up something in a very vivid way, a 25-year-old memory as though it was happening just now or as though it had happened just yesterday, with that intensity when the memory is brought up, Freud says hypnosis helped us to bring up that memory with hallucinatory vividness. What he means is very intense vividness. That's all that he means. Okay. Yeah, Kiona. Oh, sorry. Honey, would you like to read? Are you there? Okay.
I'm here. I'm saying, can I start from this can only be explained, or we were somewhere in the middle of the para?
This can only be explained.
Okay. This can only be explained on the view that these memories constitute an exception in their relation to all the wearing away processes which we have discussed above. It appears, that is to say, that these memories correspond to traumas that have not been sufficiently abreacted.
Here means,
and we enter.
Yeah. So what it means by abreacted is catharted out. Catharted out means fully processed, felt, and you let go.
Okay.
So this is what is by the word abreacted, meaning not fully processed and catharted.
All right. And if we were more closely into the reasons which have prevented this, we find at least two sets of conditions under which the reaction to the trauma failed to occur. In the first group are those cases in which the patients have not reacted to a physical trauma because the nature of the trauma excluded a reaction, as in the case of the apparently irreparable loss of a loved person, or because social circumstances made a reaction impossible, or because it was a question of thing which the patient wished to forget, and therefore intentionally repressed from his conscious thought and inhibited and suppressed. It is precisely distressing things of this kind that under hypnosis we find are the basis of hysterical phenomena. Example, hysterical deliria in saints and nuns, continent women, and well brought up children.
So we can see here what Freud is describing, that he's trying to say that when high volume of negative affect was generated, why was the person not able to process and express that affect? Because if he had done that, processed and expressed the affect, the situation of symptom would have never come about. So he says, what are the reasons? So he says there are two conditions under which the reaction to trauma fails to occur. By reaction here, what he means is processing and catharsis.
Yes.
That the processing and catharsis of feelings fails to occur. First situation where there was no way to respond because the person that the patient loved is no more. Let us say you are angry with somebody and that person dies. Now, how do you express your anger because the person is dead? In Hindi movies, we can have this dialogue कि कब्र से निकाल के गोली मारूंगा. But in reality, we can't do that. So this is one situation. Second situation is the social circumstances would not allow you. It is like if you are very angry with your father and you want to slap him, the culture and the social situation won't allow you, apart from your own morality and your love and concern. So this is often the situation of many people who have, in India particularly, people with frozen shoulder. That they come with a frozen shoulder, the orthopedic doctor asks them to get an X-ray done, nothing comes out. But the person reports pain and difficulty in movement. In many cases it happens that they have an intense desire to slap the father and they are able to hold back that action by freezing the shoulder, and the pain of the shoulder also gives you an idea of pain in the person given to him by the father. At the same time, this is also self-punishment of guilt for harboring such thoughts.
And what is this hysterical deliria in saints and nuns? Deliria.
Deliria is future of delirium, and hysterical delirium means you speak something which seems irrelevant and incoherent, or you do things which seem psychotic. So you can see here all the examples in saints and nuns, incontinent women, which women coming from very well respected cultured families and well brought up children, and all of them means people in whom by today's standard romance and sexuality is highly repressed. So you can see that today you don't see many patients of hysteria, especially of convulsions, as you used to see before. And this brings us to a very important element of effect of culture on the type of pathology which is seen pervasively in society. And we realize that there is a social aspect to sickness always. In the biological health, for example, if the municipality is not working well, communication diseases, they spread very fast. Similarly, if there is something wrong in the culture of a social group, then the social group becomes prone to certain psychological issues. So in those times, excessive repression of the Victorian times, the Christian Catholic morality excessively strong, created almost a pandemic of hysteria. And now the pandemic is no longer seen in the Western world, because the causes of the pandemic are gone. The liberal orientation which has come in the Western world related to romance and sexuality have removed from the roots the causes of this pandemic of hysteria, which used to be a pandemic at one time. So he gives example of saints and nuns, well cultured and well brought up women and well brought up children, meaning extremely, by today's standards, extremely doctrinated into severe repression of romantic and sexual part of their life. And in this group particularly, hysteria was very common because the repressed romantic and sexual desires, they were forcing themselves up from the unconscious in the form of some symptom or hysterical delirium. Is it clear?
Yes, sir.
Yeah, please go on. The second group.
The second group of conditions are determined not by the content of the memories, but by the psychical states in which the patient received the experiences in question. For we find under hypnosis among the causes of hysterical symptoms, ideas which are not in themselves significant, but whose persistence is due to the fact that they originated during the prevalence of severely paralyzing effects, such as fright, or during positively abnormal psychical states, such as the semi-hypnotic twilight state of daydreaming, auto-hypnosis, and so on. In such cases, it is the nature of the states that makes a reaction to the event impossible.
So let me make one more comment on the social and cultural aspect of psychological sickness. As society changes, the type of sicknesses we encounter on a large scale in society, they also change. So Kohut made a very profound comment on this point. He said, in Freud's times, most people who came for therapy were suffering from a drive frustration problem, that they had a very strong desire and there was a very strong suppression or repression. So the drive was frustrated, the desire was frustrated. Okay. Today he says, most people who are coming have character issues, have self problems, and most people have early life object loss problems. So Kohut divides the patient population into two. He says the tragic man and the guilty man. Freud's patients, who essentially were coming from a drive frustration situation, he calls them the guilty man. And the kind of patients that Kohut saw during his time, much later than Freud, he calls them the tragic man, where the problems are of early life parenting and early life object loss. It is not so much that there is a sexual desire which is repressed. Rather, it is that in very early life object losses have taken place, or parenting has not been as it should be, or social practices of upbringing are such which are themselves traumatic, society doesn't know them to be traumatic. For example, this whole practice of keeping very small children in their own individual rooms very early in life away from the parents, or to put children in the back seat of the car alone with that seat belt, and both the parents are in the front. Psychologically speaking, I don't see that these two are very healthy practices. But I am told in the Western countries, these are quite common practices. Both parents.
Sorry.
Yeah.
Say for instance, a couple puts their child at the back seat, but constantly is either looking back and interacting with the child or rocking the chair from time to time. Does that help?
Yes, it helps. If that is done, the chances of that becoming traumatic are very low. So if you want to analyze that particular situation, the key variables in that situation are: one, what is the age of the child? Number two, what has been the early experience of the child in terms of the good breast and the good mother? And number three, what is the constitution of the child? So if we are looking at children above 4 years of age, and if you can keep engaging with them off and on, that should be okay. But if we are looking at child, right, who is very young, less than 3 years of age, and who may not have had a very good breast and good mother experience in the first year of his life, then we are looking at a potentially traumatic setting. So of course there are variables involved. We can't put a situation as a trauma generating machine where absolutely every time trauma is generated. That is not the situation, but these are prone to trauma generation. And when we can have an option, why to go for this kind of risky things? Even if the potential for generating trauma is 60%, why take the risk of 60% if a safer practice, which is a substitute, is easily available? So that is one part of the story. The second statement he says is, he brings in the element of the state, that the psychological state in which the patient is or the person is, that also is a very important element which determines whether the event will become traumatic or not. So what he says is, number one, what is the strength of the stimulus? What is the strength of the stimulus? That is one important element. How does a person interpret that stimulus in general? Second element. And what is the psychological state into which the person is the third element. And all the three come together to determine how much negative effect will be generated. Once it is generated, how much of it can be expressed and processed, and how much is left out unprocessed. And once it is left out unprocessed, can the unconscious mind handle this level of unconscious, unprocessed negative feelings? And if the unconscious mind cannot handle, then it will create some symptoms either in the area of mental health or in the body through a psychosomatic sickness. Is it clear? Any questions?
Yes, sir, clear.
Okay. So this brings us to the very important element of the state, that the state of mind is very important. Now, it is in psychoanalysis, we are still not very clear about what are the variables of a state. How does a state get created? Because Freud here talks about a state of mind which predisposes you to getting hysteria. On the other side, we also talk about creating a state of mind in therapy which predisposes you to getting out of sickness and becoming healthy. And in order to create this state in your mind, which is more suited to healing, we have this frame, the psychoanalytic frame of therapy, that the person will come and speak about himself. The therapist will be anonymous. He will not speak much. He will give interpretations. He will be agent of reality. He will be holding and so on. Similarly, in ISTDP, we create the state by putting aside behavior and thought and asking the person to tap into his negative feelings. And when the person starts to go into his deep-seated feelings, right, suddenly a state is created where it is easier to achieve transformation. In hypnosis also, we are creating the state of the trance. And in that trance, we are using other techniques, including the technique of suggestion. So there are broadly two kinds of therapies in the world of therapy. Therapies which create a state and after creating the state use their tools. Second group of therapies where they don't go into creation of states, they just directly do therapy without doing anything to create a particular state. So if you look at existential humanistic therapy, cognitive therapy, they don't create a state. But if you look at psychoanalytic psychotherapy, hypnotherapy, ISTDP, psychodrama, they create a state, and in that state then they use the tools. Right? Is it clear?
Yes, sir.
Yeah, please go ahead.
Both kinds of conditions may, of course, be simultaneously present, and this, in fact, often occurs. It is so when a trauma, which is operative in itself, takes place while a severely paralyzing effect prevails or during a modified state of consciousness. But it also seems to be true that in many people, a psychical trauma produces one of these abnormal states, which in turn makes a reaction impossible. Both of these groups of conditions, however, have in common the fact that the psychical traumas which have not been disposed of by reaction cannot be disposed of either by being worked over by means of association. In the first group, the patient is determined to forget the distressing experiences and accordingly excludes them so far as possible from association, while in the second group, the associative working over fails to occur because there is no extensive associative connection between the normal state of the consciousness and the pathological ones in which the ideas made their appearance. We shall have occasion immediately to enter further into this matter.
So what he says is that why does the working through, right? Okay, so first point he makes is that we talked about the state, and he says if we look at the stimulus, the normal interpretation of the stimulus and the state. So he says at times the stimulus and the interpretation of the stimulus may be such that a state may get created if it does not exist already, or it may not get created and directly a traumatic thing can happen. In either case, what he says is that there are two kinds of situations which happen when the huge volume of negative affect cannot be processed and catharted out. What are the two situations? In the first situation, there is a link between something distressing that the person feels, which may be a symptom, or it may just be a distressing something. Something that the patient feels distressing is linked to the traumatic event, and the person tries very hard to avoid, therefore, any going near to anything which is associated to the traumatic event. So we see avoidance. We see avoidance and discomfort with something, the reason for which is not known. For example, we took the example of the person who was abused in the childhood by a priest and who developed in the adult life an unexplainable fear of the church. So what can the person do? He would just avoid going near to the church. He would avoid the sight of the church. He would avoid reading anything or looking at the picture of the church. So he was in that state of avoidance. So whenever we are in a state of avoidance and fear of something which cannot be explained rationally, consciously, then obviously it is linked in some way to some traumatic event. But in this situation, a linkage is there. It brings us to a very famous statement by Winnicott. He used to say, "Tell me what you fear, and I will tell you what has happened to you." There is a world of wisdom packed into this statement. Tell me what you fear, and I will tell you what has happened to you. So profound the statement is in psychotherapy. So there are two cases when this happens. One, a linkage of the traumatic event is maintained because the person is actively avoiding or fearing something. When the person is actively avoiding or fearing something, obviously it has linkage to some traumatic event in the past. So we can say the linkage is maintained. Second, there is a strange kind of symptom, but you don't see any avoidance or fearing of something, but a strange kind of symptom. Like for example, the stitching movement of the cobbler. So we don't see the person actively avoiding something, fearing something, but just repeating something, doing something strange, or not doing something obvious, where the symptom seems to be disjointed from the traumatic event. Seems disjointed. Obviously, nothing is disjointed. It's like a wireless mobile connection or a wire connection. But obviously, the connection is there. Otherwise, there is no way a symptom can exist without a traumatic event which provides the fuel to the symptom to keep going. Right? Apart from the fuel provided by secondary gains. If you are interested more in the idea of the state, right? I have a video on my channel called State of Change. It goes deeper into this whole idea of creating a state for healing. Yeah, please go on.
It may therefore be said that the ideas which have become pathological have persisted with such freshness and effective strength. Hello. So
Yeah.
I don't know. I can't see. Wait a minute. Effective strength because they have been denied the normal wearing away process by means of
Reaction and reproduction in states of uninhibited association. We have stated the conditions which, as our experience shows, are responsible for the development of hysterical phenomena from psychical trauma. So this is very important. In doing so, we have already been obliged to speak of abnormal states of consciousness in which these pathogenic desires, ideas arise, and to emphasize the fact that the recollection of the operative psychical trauma is not to be found in patient's normal memory, but it is memory when he is hypnotized, which means one part of his memory is not accessible to him when he is normal and awake, but it's accessible to him when he is hypnotized. So we are going there to the concept of the unconscious mind, that there is a part of the mind not accessible to us in our waking state, but accessible to us under hypnosis. The longer we have been occupied with this phenomena, the longer we have been occupied with this phenomena, the more we have become convinced that the splitting of consciousness, which is so striking in well-known classical cases, under the form of double conscience, is present to a rudimentary degree in every hysteria, and that the tendency to such disassociation, and with it the emergence of abnormal states of consciousness, which we shall bring together under term hypnoid, is the basic phenomena of this neurosis. In these views, we concur with Binet that the two Janets, though we have had no experience of the Binet and the two Janets, though we have had no experience of the remarkable findings they have made on anesthetic patients. So what we are seeing here is a very important paragraph. We are seeing beginning slowly of the concept of the unconscious mind making an advent. Honey, can you hear us?
Yes, sir.
Okay.
Sorry, I lost the connection.
Achha, achha. In this paragraph, we see something very important emerging, and that is slowly we see the idea of unconscious mind emerging. So what he says is that a person has access to parts of memory only in the hypnotic state and not in the waking state. So he says the form of double conscience, meaning almost two different minds, is present to a rudimentary degree in every hysteria. Two different minds, two different moralities, two different consciences, and that a tendency to such disassociation, and with it the emergence of abnormal states of consciousness, is the basic phenomena of this neurosis. We concur with Binet and the two Janets, meaning you see a person and we see there are two persons in every person. We see the person as he is in his conscious mind, and we see the person as he is in the unconscious mind. And this seems to be universal, that we see two people in the same person. There is a very good book on this title, Single Person Plural, that there seems to be two people in every person, the conscious and the unconscious. And in anesthesias, they have made some experiments and found similar things. Yeah, Hari, we can go on. We should like to balance.
We should like to balance the familiar thesis that hypnosis is an artificial hysteria by another.
The basis and
Sir,
science.
I'll be disturbed. I think if Kiona reads the para, it would be fine.
Kiona?
Can you tell me which line?
This state, the cursor here.
Yeah. These states share with one another, and with hypnosis, however much they may differ in other respects. One common feature: the ideas which emerge in them are very intense, but are cut off from associative communication with the rest of the content of consciousness. Associations may take place between these hypnoid states, and their ideational content can in this way reach a more or less high degree of physical organization. Moreover, the nature of these states and the extent to which they are cut off from the remaining conscious processes must be supposed to vary, just as happens in hypnosis, which ranges from a light drowsiness to somnambulism. I don't know what that means. From complete recollection to total amnesia.
So he is talking here of that we would like to balance the familiar thesis that hypnosis is an artificial hysteria by another. The basis and sine qua non of hysteria is the existence of hypnoid states. Meaning, he is now replying to critics who say that when you introduce a state of hypnosis, the person knows nothing about it, and in the waking state he cannot connect together what went in the hypnotic state and what is going on in the waking state. They two seem like disjointed two states of the same person. And this is also true in hysteria, that after the person comes out of the hysterical state, often he does not remember what happened in the hysterical state. So he says this is not true. There is a difference between the two. One common feature is the ideas which emerge in them are very intense but are cut off from associative communication with the rest of content of consciousness. Associations may take place between these hypnoid states and their ideational content. So what happens is, in hypnosis, when you access the ideas and intense emotions which are not available to the waking state, but when you deal with them, the effect is found in the waking state. So this is not the hypnosis in which you are taking the person, is not one more episode of other induced hysteria, but it is a very separate kind of state introduced for the healing purpose. So we can't equate the disassociative state of hypnosis, which is a health enhancing state, from the disassociative state of a hysterical episode, which is just one more repetition of pathology without any movement towards healing. Are you getting the difference? The difference between a disassociative hysterical episode and a process of hypnosis.
So does the hypnosis always helps in healing, or it might have a negative effect also? Just asking.
Very few people have reported negative effects. Some people have, but very rarely, number one. Number two, it may help in healing, it may not help in healing. Many people go and come back without much healing. In fact, this was my experience also. I went into hypnosis as a patient to heal my asthma, which I believe is psychosomatic. And I went there for 3 months, twice a week, 3 hours each session. So how much would it be? 6, 24, 72 hours. So about 72 hours of hypnosis. But two problems came in my experience. One, I could never go into a trance completely, and I did not come out of it healed with the problem that I went in with. Similarly, I had a friend of mine who also went into it for some problem of his. He had a problem of anxiety. It did not came out healed of that problem. So my personal experience of my own and of my friends and people I know is that the claims which are made by hypnotherapy seem to be exaggerated, because the marketing is done in a way that we get an impression that this is like a solution for every cure. You just go in and you come out with a solution. So that is the way we get an impression, but this is not true.
Should I continue?
We have 1 minute to go. Should we take a break of 15 minutes?
Okay, sir.
Yeah.
So we meet at 5 o'clock.
Okay.
Okay.
Okay.